My guest today is Dr. Jane Orient. I like this lady already. I just asked her, I said, how do you want to be referred to, as Dr. Jane, Dr. Orient, Doc, or what do you want to be called? She goes, just suit yourself. In other words, it doesn't matter. So I like that. No pretense with her whatsoever. She was the executive director of the American Physicians and Surgeons. She is an on-air contributor on speaking on healthcare reform. Dr. Orient has appeared on some of the largest TV and radio networks in the country and has been printed in hundreds of local newspapers. She's executive director of the, okay, this goes on and on. This lady's got the credentials out the kazoo. She's talked many, many times about what's going on with the open borders, what's going on with healthcare, what's going on with measles, what's going on with these forced immunizations. I wanted to bring her on today because she's one of the most articulate spokespersons I've ever heard on this particular topic. And so, good morning, Dr. Orient. It's good to have you on with me today.
Hey, good morning, Ted.
And I'm looking forward to doing a show with you today, and I'm looking forward to some questions. Do you want to open this up? We have a few minutes. Do you want to talk about informed consent and kind of give an audience an idea of what you want to talk about today, or do you want me to start asking you some questions?
Well, informed consent goes back to the Nuremberg trials, or maybe even, certainly before that, it's been assumed that patients do have certain rights, and that physicians should not be, at least if they're operating according to the ethics of the Oath of Hippocrates, forcing patients to have treatment, prescribing for them treatments that may be harmful for the good of the whole or for whatever reason. And this was codified after the Nuremberg trials because of atrocities, and not just in Nazi Germany, but here, like with the infamous Tuskegee experiments, when people were experimented on in ways that were very harmful to them without even being informed of what was happening.
I agree with you 100%. In fact, I know a lot of the Nuremberg trials were about what had happened in the Nazi Germany concentration camps. But what I find even more sad about this is a lot of the research that was used from the Nazi concentration camps were brought into the United States and used by our own CIA and Operation Paperclip and all the different mind control experiments they did with MK Ultra. I'm not sure if you're familiar with any of that or not, but you can't be using information that was garnered basically through the torture of other individuals on how to control the masses of people. I think it's actually quite sad. A lot of folks are saying that. I'm sorry, go ahead.
I can't speak to those particular things, but I think that we are doing a lot of things now that we don't call experimentation, such as mass immunization campaigns or imposing guidelines or protocols for all types of medical treatment and a wide range of people without even doing the sort of follow-up that would enable us to identify harms.
You're exactly right. I know California is now trying to end exemptions for religious beliefs. How do you feel about that, the ending of exemptions for religious beliefs who could not have vaccinations?
Well, I think that mandatory vaccines are improper. They violate patients' rights. They violate the Nuremberg Code. All medical interventions, including vaccines, have both risks and benefits, and those can vary with the circumstances, with the individual, and it should be a bedrock principle of medical ethics that patients have the right to determine what treatments they want and which ones they want to refuse.
I agree with you 100%. I'm not diametrically opposed to vaccines, but I think they need to be better tested. I believe the adjuvants need to be taken out of them. I believe we need to be getting clean vaccines without things like aluminum and thimerosal and all these other ingredients that are added to them. I believe that we've been in a situation now where the FDA has not tested these vaccines because they have been given blanket immunity against prosecution, and they're allowed to pretty much inject us with anything they want without proper double-blind clinical trials or tests. I don't even know what to think about an Ebola vaccine that would be coming out and rush through the vaccine process and what in the world that could do to the population. What do you think about the Ebola problem, and what do you think about an Ebola vaccine?
Well, they're working on a number of Ebola vaccines, and yeah, there is a big problem with testing them. I think that the way the vaccines are tested now, they determine efficacy by whether you have antibodies. But that doesn't necessarily mean that those antibodies are going to protect you against the disease. Of course, with HIV, you've got antibodies, but they are believed not to work.
We got 10 seconds to the break. We'll be right back. Get ready for your questions, Dr. Jane Orient. Dr. Jane, you and I were talking during the break, and I asked you about clean vaccines. Tell everybody what you said about if you don't know if there's even possible to have a clean vaccine. Go over that in detail again like you did with me during the break, please.
Well, vaccines are a very complicated thing. If it does have a live virus or even it had a a virus that once was live and then was killed, you have to grow it in tissue culture. And so that's a biological system. And there are all kinds of things that can be present in biological systems, like other viruses that we don't know how to detect. There was a big concern about this SD40 virus that was in the early polio vaccines. And there are certain viruses we know how to look for and others that we may not know how to look for. But this is the reason why we have things like thimerosal in the vaccine. It may be called a preservative, but it's really a disinfectant.
Sterilant.
And even the thimerosal-free vaccines, they have thimerosal in them to begin with, and they have to kill off the things you don't want, and then most of it is removed. Then vaccines contain adjuvants. A lot of the aluminum salts that are in vaccine are adjuvants, and what these do is they stimulate the immune system. And the reason that's necessary is because a lot of the antigens in the vaccines are weak, and they don't do a very good job of stimulating the immune system, and so you have to add something to it to jazz up the response. The problem is that we're not sure that this is necessarily specific for what you're trying to do, for the measles or whatever is in the vaccine. But what about exposure to other antigens like peanuts? And I think it's very concerning that a huge number of children these days are having to carry EpiPens around with them or asthma inhalers because we have so many food allergies and so much more asthma than we used to have.
So what you're saying, forgive me because I'm not trying to put words in your mouth, but what you're implying, or what I'm understanding from this is a better way to say this, is that when people or when children are getting these immunizations with these adjuvants in them, that they're hyper-accelerating their immune response in their body. So if they eat peanuts while they're being vaccinated or before or after, their body can actually develop an allergy against or towards the peanut because of the hyper-acceleration of the immune system.
I'm just talking theoretically, but basically that's what I'm saying. That I have seen it in the literature here and there. I have never seen any studies about it, and I don't know why we have so much more allergies to peanuts now than we used to, but it seems to me, since it's devastating and potentially life-threatening and just a pain in the neck for so many kids at best, that we ought to be trying to figure out why.
Well, it's the same thing with the glyphosate, which is used as a desiccant before crops are harvested, and we end up with this Roundup, this weed killer in our food that's caused all types of problems with celiac disease being linked to that now, and with all types of intestinal disorders and stomach inflammation. And now you're the first person I've ever heard say there's a possibility, and I realize you're just speculating at this point, that we could be having an increase in these different types of allergies for different types of foods if we're being immunized around the same time that we're being given peanuts, which actually makes sense to me. What about, it seems to me that they're saying to us, and I talked about this with John Rappaport on the show, it's pretty much now with what the government is doing, with the tyranny that seems to be enveloping the United States, it's simply shut up and do what we say. Sit down, take your drugs, take your immunizations, and don't argue about this because we don't care about the Nuremberg trials. If we want to kill people, we can for the sake of the group. And I believe that's what Nuremberg came out and said, that people were allowed to be killed individually for the sake of the entire collective. I believe you called it herd medicine on another interview that I've heard you on, and I found this interesting. Go ahead and explain the concept of herd medicine. I want you, and herd immunity. I want you to explain that because I thought that was very, very interesting when you were talking about that on this other show I heard you on.
Well, of course, herd immunity started out as a veterinary concept that you want your cattle or your sheep all immunized so that they are protected. I prefer to call it as population immunity because I don't like to think of my patients as cattle. But the idea is if you're going to stop an epidemic, you want the organism to run out of people to infect. And the age-old way of doing that is trying to isolate the people who are infected and their contacts, or the virus has to run into a person who's had the disease before and is already immune, and this may be helping to restrict the spread of Ebola in Africa, or you want it to run into someone who has vaccine-induced immunity. So there is some controversy about how many people need to be immune before an epidemic, if it's started, will just die out quickly. And I've seen different figures. It probably depends a lot on how contagious the disease is. But for some diseases like measles that are very contagious, people will say that 90 to 95% of the population needs to be immune to keep an epidemic from spreading exponentially. And I don't know exactly what the figure is, but I doubt very much that we have herd immunity to measles in the country now, even though more than 90% of children are vaccinated, simply because the vaccine wears off. And adults no longer have the long-lasting, probably lifelong immunity from catching natural measles, but they have immunity that is waned. And you can weigh how many boosters you're going to give them in their life. Each one is probably less effective than the one that came before. So, we can't get rid of the age-old public health method of trying to identify cases and keep them from spreading.
Well, what's interesting here, you're telling me that when a person has the measles when they're young, they end up with a lifelong immunity. And, of course, we all know that the vaccines simply don't do that. A lot of the people that are who came down with the measles here in Disney a few weeks ago, 18% of them this year, 14% the prior year, or the year before that, we had another breakout of measles, had already had up to 1 to 2 different vaccines, which simply were no longer being effective in their bodies. Also, another interesting, tell the listeners about what happens when a child is being breastfed and the mother's had natural measles and what's transferred through the milk.
Well, most babies in the past got antibodies across the placenta, as well as some in the breast milk from their mothers who still had antibodies in their blood. So they had a passive immunization. That is, they're using their mother's antibodies, which will work for about the first 12 months of life when the baby is most susceptible and when he can't be effectively immunized. But babies these days are more vulnerable because we are almost completely dependent on vaccine-induced immunity. And unfortunately, the age of incidence of measles, if it occurs here, is different. It used to be 5 to 9-year-olds got most of the cases, and they usually fought it off quite successfully. But today we're having many more cases in babies and in older adults, and they're much more susceptible to the complications.
Tell everybody why infants, when they're immunized, it really doesn't work very well for the first 12 months.
Well, I guess it just doesn't. For whatever the immune system is not mature enough to respond in the way that's expected. So it's just a fact that it doesn't work as well. And of course, babies are immunized sometimes even in the delivery room for some diseases. And I never could understand why that makes sense if their mother's not infected, say, with hepatitis B. But often it's done with the rationale, well, we've got to get them now because they're under our control. And if we wait until they start experimenting with drugs and sex, they will be harder to catch. And if you ask, well, how long does immunity last? Oh, we hope maybe 12 years. There are things that doctors believe in and that they are promulgated by the American Academy of Pediatrics that to me just don't make sense.
Okay, let me reword that, if you don't mind, a little bit for the listeners who aren't as medically oriented as you are. What ends up happening is we're getting children who are being born immediately getting a hepatitis B shot. The mother is assumed to have and to be a hepatitis B carrier, according to Dr. Mendelsohn, who wrote a book on this years ago, that they assume that she's a IV drug user or a prostitute and she has the potential of having hepatitis. They want to make sure that child is protected immediately from the hepatitis that the mother may or may not have. Plus, they're expecting that child to become an IV drug user, prostitute, engage in sexual activities, and they want to protect that child immediately upon birth for that particular set of variables in the case that child decides to do all that, but it's only good for the age of about 12. So they're assuming that these children are going to be IV drug-using prostitutes having sex with everybody before the age of 12 when they're trying to spread the hepatitis. You realize how stupid that sounds? And I know that's what they believe, but does that make any sense to anybody who actually believes that stuff?
Well, people have told me that at the Public Health Committee meeting. Doctors have told me that. But, there is a way of testing the mother, and mothers are routinely tested to see whether they have hepatitis B. And if they are positive, then the baby should get both gamma globulin and get passive immunity to it, as well as the vaccine. And in some countries, hepatitis B is very widespread. In the United States, very few mothers have it. And we can figure out whether they do or don't.
What's the actual? Is it 1 in 100,000, 1 in a million mothers have hepatitis B? Do you know the numbers on that?
No.
Okay, but I know it's some infinitesimally small number, and it's interesting to me. I've had a lot of my friends and other colleagues that have gone out and tried to get information on this type of stuff from the CDC through the Freedom of Information Act or through the FDA or whatever they're trying to get. They've had zero result in getting any of this information. Have you ever had any luck in getting any of this information, any statistics, any of these efficacy trials from any of these organizations through the Freedom of Information Act, or are you stonewall like everybody else?
Well, we did submit a request for information about the safety testing of hepatitis B in newborns, and we were stonewalled. That was years ago. I did get a response to one FOIA request, and that was about the rotavirus vaccine. Some pretty interesting internal email from the CDC of saying, we think there's something to this intussusception, which is intestinal obstruction, and if this comes out, we're going to get clobbered, which does nothing to inspire confidence that the CDC is necessarily telling you everything it knows.
Why does the CDC own a patent on the Ebola virus, Dr. Jane?
I have no idea.
I've asked that to so many guests, and nobody can figure out this is for the money thing. One more question about the Ebola, because I know you spoke a lot about that last summer. Do you think some of the Ebola problems that were going on in Africa that were being promulgated by the mainstream media was because of the vaccine they were giving these folks who live in Africa?
Oh, I can't speak to that. I don't know whether they were giving a vaccine. I don't know who got it. That's in the realm of rumor and speculation.
We're coming right back to the break. We'll be right back with more with Dr. Jane Orient. Stay tuned. Dr. Orient, we were talking during the break, and we were talking about the adverse effects of the hepatitis B shot. I have a friend of mine who has a daughter who was just born a few months ago, and she almost died immediately following the hepatitis B shot. I was speaking to you during the break, and you said that you know other people that you've never met somebody individually who's had that problem, but you know of other people you've read or heard or spoken to that have the same conditions. Can you tell me some of the side effects and some of the dangers associated with the hepatitis B shot at birth?
Well, there is death. There are a number of reports of death in the vaccine adverse event reporting system that have never really been investigated. One of the things that is fairly common, apparently, is that the child will scream uncontrollably for days or weeks every time they get a shot. And, as soon as they get better, they give them the next shot, and the same thing happens again. So this suggests that they may have a kind of brain inflammation because the cry is really quite abnormal. And they recover from it, but then there may be some of them who don't.
Dr. Russell Blaylock talks about this. I think it's called what's it called?
Encephalitic cry.
Yes, encephalitic cry. That's correct. And so what happens is these kids are just screaming because of that. Also, while we were at the break, we were discussing this. I want you to share it with the listeners. When we have a double-blind clinical research study that's trying to determine the efficacy of a certain drug or a certain condition or a certain food additive or whatever, it's not medically or ethically correct to try to induce a cancer. For instance, if we're going to test aspartame for brain cancer, we can't really set up a double-blind clinical research study with human beings to see if they're going to get brain cancer from a certain drug because it's not considered medically or ethically correct. Why is it that they consider that testing these vaccines on these populations of people is medically or ethically correct? Why is that okay when they won't allow them to do a double-blind clinical research study that could cause death? That makes no sense to me. Is there any way you could try to explain that?
Well, I think if you're going to figure out whether something causes death, you test it in animals. But there's a problem in identifying adverse effects of any drug or vaccine, and that is a lot of them are extremely uncommon. So doctors will never have seen a case in their practice, and they're just so rare that they're not going to turn up in your trial. How many kids can you get in your trial? And that's why it is so important to do aftermarket surveillance so that if something rare turns up, like with chloramycin used to be a very commonly used antibiotic, it could shut your bone marrow down once in every 50,000 times, but you don't find that out in the initial trials. It's just too rare. But our aftermarket surveillance is not so great, and there seems to be a reluctance to make the results known to the public.
Well, also what happens, too, we have 22 shots by the time a kid gets to the first grade. We're going to start these forced vaccines, apparently in some states with absolutely no safety studies to prove the efficacy or the safety of these vaccines. And what I found also was that we're having about a 1% reaction in vaccine cases now. It's 1 out of 100, and that's not even anywhere near statistically safe. Do you have the information? I believe it was supposed to be less than 1 in 10,000 or 1 in a million on pharmaceutical drugs, but you were having a 1% reaction on vaccines. Explain that to the listeners, if you don't mind.
Well, when I've talked about this, it's regard to Environmental Protection Agency rules. If there is an occupational hazard that could cause death in as many as 1 in, or few as 1 in 10,000 people, then there are regulations to try to restrict that. Or for the population as a whole, they may say 1 in a million chance that you'll have a reaction to this. We have to have regulations to protect you. But it's just such a double standard is just shocking that with vaccines we would tolerate so much more. But the rationale is, of course, your child is being protected against the disease, which is so much worse than the vaccine, they say, without knowing either the absolute value of the risk with either the disease or the vaccine. And plus, they will say your child is a hazard to the community as a whole if he is not vaccinated. It's almost as if a child has a typhoid Mary just by being unvaccinated, and you really can't get measles from somebody who doesn't have measles.
That's absolutely correct. Now, one other quick question. When you were in practice, in both of our younger years, back in the 50s and 60s or 70s, or whenever you actually started or went into medical school, or you knew kids that came down with measles, did you ever know anybody who actually got who got sick and died, who had a deadly reaction to the measles that said themselves, or the people just have a fever and a headache for a few days and they were okay?
I personally did not know of any. I do know of a person who was deaf in one ear that he said was because of measles encephalitis after taking the after having measles. So, I mean, these complications do occur from measles, maybe 1 in 1,000, maybe 1 in 3,000. But how often do similar things happen from the vaccine? We don't really know.
We're coming to your phone call in just a minute for Dr. Jane Orient. First, I want to talk about antidotal studies and why they're important in medicine. And then I want to ask Dr. Orient why they're not being used very often, why they're always dismissed, and why people always like to buffoon them. Tell them what an antidotal study is, Dr. Orient, and why we should be looking at them.
Well, anecdotes, ANECDOTES, those are little stories. If you tell an anecdote, you're just telling about an event, or maybe even you're making up a story. And this term is used in a derogatory way for case reports. But as somebody said, every epidemic begins with a single case report. And if you have a case that is very carefully observed, then it's something that you might want to pay attention to, or you should pay attention to. And especially if you have evidence in the way of like they call a de-challenge, re-challenge experiment. Like if somebody takes a drug and they break out in a rash, and you take the drug away and the rash goes away, that's a de-challenge. And then if you expose the patient to the drug again, which may not be a very good idea, but if you do and he has the same reaction or worse, this is very good evidence that the drug was the cause of the rash.
Why do most doctors in the FDA try to ignore that and don't really bring those studies up?
Well, I think that they don't want to find out that some of these vaccines could actually be causing devastating side effects.
Well, they simply don't want to know. They don't want to have to. I guess sometimes it's easier not to know the truth, isn't it?
Well, they do. They have proposed studies, or they have presented studies that, like, vaccines don't cause autism. Well, these are statistical studies. They involve all kinds of jumping through statistical manipulations to deny that there's an association. But they ignore the de-challenge, re-challenge events that are recorded. And we don't really have a controlled study possible. You can't really get informed consent to say, well, we're going to find out whether this vaccine causes autism or not. Sign here for consent. But what we do is if we find out after the fact that this may be occurring, then you do like a case control study where you look back and see if there are cases of autism, how many had the vaccine versus how many didn't. But if you have immunized virtually every child in the population, your control group is gone.
You're absolutely right. If the control group is gone, then then you can't have an accurate study because you can't get a standard deviation as far as what's going on with the other group. You're absolutely right. You're absolutely right. Okay,
what we really need.
Yeah, let's go to the phone calls right now. We got a bunch of calls for you. Let's go to Johnny in Missouri. Johnny, Missouri, you got a phone call. You're on the air. You're live. Are you up? I'm sorry, Johnny. I think I just cut you loose. I apologize. Call back, Johnny, please. Francis in North Carolina, you're live. Go ahead for Dr. Jane Orient.
Hey, folks.
Hey, good morning.
Hey. You know, on the previous commentary you made earlier about various religions and military practice and so forth and so on, regardless of what different separate religions there are or religious practices there are, how they get tied up with a military action that drawing young girls or men into the military. That's kind of an awkward way of doing that because, quite frankly, there are separate issues between taking a life and actually doing spiritual growth, which are totally unrelated. Now, as to this other situation, as far as allergies go and vaccines and genetic modification is concerned, for something as lowly as a peanut, maybe one thing that people don't realize is that perhaps what they are using has been genetically engineered, and who knows what genes have been crossed with it, hence the reason why people have an allergy to peanut. Just like with other type of foods, stock items that are genetically mucked with, shall we say.
What do you think about that, Dr. Orient?
I can't really comment on that. I'm not really sure what the question is.
She's saying that a lot of the reasons that people are having allergies towards certain foods
genetically modified foods are blamed for this. I don't know whether that has any validity or not. I just don't know.
Any I love your comments, Francis. Any other questions?
That's it. Y'all have a great one.
Thanks, wonderful. Back to Johnny in Missouri. You're on the air now, Johnny. I can put my glasses on so I can actually see the board. Go ahead, Johnny. What's your question for Jane Orient?
Watch your buttons, man.
Hey, man, you're right, man. You got my bad.
Yeah, been there, done that. Hey, do you all remember the term Starlink corn?
Starlink corn, yes, I do.
Okay. Do you remember what the dietitian said when they did their studies on what the effect of the food supply would be? The contamination of the food supply?
No, go ahead, tell us.
Okay. It was the worst case scenario is you would see an increase in allergies. And that was their finding.
Okay.
Okay. So now here we are, what, Ted, that's like 30 years later?
Oh, got to be that long. That was back in the 80s, wasn't it?
Yeah. And by the way, that was Taco Bell. Contaminated food.
Taco Bell, the bastion of health foods.
Well, yeah, right up there with them, boy. But I find it real interesting that they're seeing this correlation with the vaccines increasing the peanut allergies.
Well, no, Jane said that was her theory. She said that has not been proven. That was just a speculation that she had seen. She thought that might have some type of impact on it. And forgive me, Dr. Orient, for speaking for you, but I wanted to make sure we cleared it up. Did I say that pretty much close to what you wanted to say?
I think so. It's important to realize that correlation does not prove causality. But just because one thing changes and another thing changes does not mean that the two are connected. Like if we have an increase in the stork population at the same time we have a lot of births, it does not mean that the stork brings babies. So this is a real danger for looking at observational studies.
I think what Johnny is saying that, we talk a lot about GMOs on the show. Dr. Orient, I apologize for you not being told what the folks like to talk about. But we talk a lot about GMOs and what the GMOs have done and some of the studies of the GMOs that have actually proved it pretty bad for you. And so what we're trying to do is find out what's causing all of this huge autism rate in children increase, and that we have all of these horrible allergies in all of these kids. Something's doing it. We don't know for sure what it is. And so it's one of these things, it's like Dr. Orient just said, unless we can prove specific causality, we have to kind of speculate unless they want to start setting up double-blind studies. And as she just said a few minutes ago, they really don't want to know what's going on. Do you have another question, Johnny?
Yeah. Pointedly to the doctor, thanks, Ted. Have they done any actual studies on the, what do they call it, the cytokine storm?
The cytokine storm is the inflammation storm that occurs.
Right. Have they done any focused studies on that? I know it'd be like testing Ebola on live patients, but...
Well, Dr. Blaylock talks a lot about that. Are you familiar with that, Dr. Orient, about cytokine storm?
Well, the cytokine storm is your body's own reaction to diseases and other insults, and there's a lot of basic physiology known about that, sure. And that's one of the things that probably causes fatalities in sepsis from any cause or from Ebola. Your body's own reaction gets out of whack.
Sure.
Or, it overreacts.
Now, Dr. Blaylock says in the research that I've read seems to indicate also, Johnny, that the cytokine storm, the severity of that could be massively diminished by the use of vitamin D as in dog 3, D3. But I always recommend if you're going to take D3, you combine it with vitamin K2 to prevent arterial calcification from the extra absorption of the calcium from the extra vitamin D. So K2 and D3 need to be taken together, but Dr. Blaylock says that massively reduces the cytokine storm. Have you seen any studies on D3 decreasing the cytokine storm?
No.
Dr. Orient. Okay.
I don't.
Any more questions for you, Johnny?
No, go for it, Ted. Appreciate it.
Thanks, buddy. All right, we're going to go right now. We're going to go to Vern in Virginia. Vern in Virginia, you're on the air. Do you have a question for Dr. Orient? Go ahead, Vern.
Yeah, I was wondering about if she could provide a appropriate response in regards to this frenzy of mandated vaccines because the unvaccinated people are going to cause a public health problem. This medical cult, like you said, Dave, is just getting way out of control. And they are using public health as the pretext to mandate the vaccines. How do you respond to them if they're taking away our exemptions?
Okay, Dr. Orient, I believe you've got a website that talks about that, and you have information for folks, don't you?
Well, there's some information on apsonline.org. We do not exist for the purpose of telling people what they should or should not do with respect to therapy. We are on the record as opposing mandatory vaccines. And, yes, any outbreak of anything is yet another pretext for trying to do away with the exemptions that exist. Yeah, and
what is the name of the problem? What is the name of the website again? I want to promote your website.
Well, apsonline.org.
apsonline.org. Okay.
Two A's. aapsonline.org.
Okay.
And up in the upper right-hand corner, there's a link to the original site, which has vaccines listed under issues, and there's some information about vaccines there. We are not an anti-vaccine organization. Most of our members give a lot of vaccines. We are simply about the right of parents or patients to make their own decisions about this. Informed consent, in other words.
Vern, if you go to Dr. Blaylock, he writes a lot of articles on this, and he'll give you a lot of statistical evidence that it links the types of problems associated with vaccines and that you can use and you can copy offline if you're opposed to vaccines and you want to have a reason for being opposed. There are all kinds of great articles that are online now. I just posted one at healthmasters.com yesterday. It's not by me. It's by somebody else. It's by a medical doctor. I think his name was Horowitz, but I'm not sure. I don't think that's the right name, but I can't remember. I apologize. I didn't expect to talk about this morning, but it's a very long article you can read. I did not write it. The doctor's name's on it who wrote it. I posted it at healthmasters.com. He goes into detail. Those are the types of things that if you want to say, I don't want to do this, that you need to bring to your state legislators and say, here's the reason I think we should have informed consent. I believe we shouldn't be forced to do anything against our will. I believe the Nuremberg trials prove that we can't be doing that because in the Nazi concentration camps, of course, they were massively experimented on, and they were basically forced to do what they were going to have done to them, like in the Tuskegee experiments. And I agree with Dr. Orient. The basic premise of vaccines is good. The problem is the adjuvants and all the chemicals and the lab tissue in which it's grown and the sterilants that are used. So there's a real problem with the vaccines that we're getting in the United States. I don't consider them to be clean, and I'd be very wary of them. And I agree with Dr. Orient that it should be up to the parent to decide what their child is going to do, not up to the all-powerful state. Did I say that okay for you, Dr. Orient? I don't want to put words in your mouth.
Yeah, I think so. And it really makes a difference. If there's a smallpox epidemic, you want to get a smallpox vaccination. If there's a polio epidemic, you probably want to get a polio vaccine. But that just changes the risk-benefit equation. And this can change all the time depending on the genetics of the individual, depending on just the disease pattern, depending on whether you're going to be traveling, depending on all kinds of things. So So you may well want to take a vaccine. In another circumstance, you might say, well, we'll just delay for now.
Well, the other thing, go ahead. Bernie, have any other questions?
I want to comment. I just resent them trying to tell us that they know better than we do. I resent them talking about the science, and then there's science that contradicts their science. And, the most effective way to avoid these conditions is not a vaccine, people. It's our own immune system by the Creator.
Yeah, I agree with you on that one.
Okay.
And we talked about that with iodine, with D2, all the different things you can use to increase your... Vern, thanks so much for the phone call. Also, I want to say one other thing, too, Jane. It's very important. A lot of people don't realize that they use a lot of latex corks in the vaccines as far as they shove the needle through the latex corks. And when you basically take a shot of this vaccine, you're getting an injection of the latex from that cork that's been embedded in the needle. A lot of people have very, very bad allergies to latex, me being one of them. If I get around a latex Band-Aid or anything, it causes massive inflammation in my skin. I'm super allergic to latex. In addition to that, my wife is allergic to eggs. And a lot of times they use eggs as a medium to grow their vaccines. And if you're allergic to eggs or you're allergic to latex, you really kind of need to try to avoid vaccines altogether because of the reaction that could occur. Let's go to Michael in New York. Michael in New York, you are live. Your question for Dr. Jane Orient.
Well, good morning. Actually, a couple comments. Number one, the bottom line on autism versus vaccines, it's obvious and very clear once you look at it scientifically. You simply do an XY plot, time in the X direction, when the vaccine started, the rate of autism on the Y side, you'll find pretty much a 45-degree one-to-one correlation guaranteed. Then you'll take the same XY plot prior to vaccines occurring and the autism, and you'll find that there is no direct 45 line coming up, where there's a direct one-to-one correlation. Any scientist like myself, when we're in a meeting and we look at a chart like that, it is obvious there's a direct correlation here. Case closed. There's no arguing that fact. Number two, regarding the vaccines, okay, there may be legitimacy if it's a proper approach, but it's still an inferior science. For example, when I raise dogs, I don't get any shots. And when the parvo shows up, I cure that parvo using Mother Nature. And they can't cure that. That's why you have to get a shot, because they can't cure it. I cure it every time. So there's a better science to this through nature as God designed it, and that's the problem with the modern medical establishment. They have no regard towards that better science at all.
Dr. Orient, should we take better care of ourselves and try natural approaches?
Well, I think that people should make decisions for themselves as to what approach they want to try. I'm not here to give you medical advice.
Well, Michael, what Dr. Orient's here today for is to tell you that she is a strong, strong opponent to forced mandatory vaccines. She's not here to tell you that she doesn't think that vaccines in some cases may or may not be necessary. What she's saying is it's exactly what you just said, Michael, that we need to have the right to determine for ourselves.
Yes, and don't get me wrong, I'm not dumping on your guest. I admire her for coming out and taking that position, because that is the proper position. But I'm accusing the medical establishment itself of practicing an inferior science when a guy like me as a scientist knows how to cure parvo and just about everything else using Mother Nature. So obviously there's a better way without a risk factor that will undermine the health of the kids or an adult.
It's interesting. Let me give you a personal example. Mike, thanks so much. I'm going to go ahead and kind of answer you offline. Thanks so much for calling. Here's what's interesting with my son. My son got a couple of dogs a few months ago, about 6 months ago, and they're both super healthy. They were 6-8 weeks out of the kennel, out of birth. They were both very, very healthy. Then one of them developed some type of problem. I didn't know what it was. And back and forth to the vet, back and forth to the vet, back and forth, injections. And what ended up happening is finally we put this to the younger dog, but now was about 8 pounds still. The one who wasn't growing, the other one was like 40 pounds. Okay, and the little one was bigger than the small one, the big one to start with. The one was like 8 pounds, one was 6 pounds. Now the one's 40 pounds, and the one's still 8 pounds. The dog was about to die. We went through all of the different vets things and what they could do. Finally, I told my son, I said, why don't you do this? Why don't you put him on a really good parasite cleanse? You know, the wormwood, the black walnut tincture, the cloves, and let's see what happens to see if maybe he's got an intestinal parasite they don't know how to get rid of. Dr. Orient, within a week, this dog started gaining weight and started feeling better. And now his size is pretty much stunted because he went through such a long period of time without any growth. But the point is, he's healthy now. We come back, we'll have the final break with Dr. Orient. Stay tuned. We're coming to your phone calls. For me this morning. We only got a couple minutes left with Dr. Orient. If you got a quick question to ask her, go ahead and ask her the question. We're almost out of time now. I got a whole bunch of phone calls, so I'm going to have to cut you a little bit short right now. I apologize. One more quick question that has been a subject that has been very, very hotly debated in the past 6 or 8, 9 months now. Since our president decided to open the southern borders, then we no longer really have a southern border of the United States, and we've had literally tens of thousands of immigrants coming from third world countries with all types of diseases coming into the United States. Is there a possibility that some of these diseases can now start causing a lot of health problems in the United States because we do have a large unvaccinated population of people that have opted out of vaccines? Dr. Orient.
Well, I think that we don't know that the children coming across the border are unvaccinated. It is said, asserted by some public health authorities, that they have very good vaccine programs in Central America. But I don't think they're bringing their vaccine records with them. And there are a lot of diseases for which there are no vaccines. It used to be that legally, I think it still is if you want to immigrate to this country, legally, you have to have a lot of health screenings. And that just is just not occurring. The children are being shipped all over the country, and they may have things like enterovirus D68, for which our children have no immunity at all, and that could well be the cause of the enterovirus outbreak that we had. But we don't really know. I think they're just not. They either don't know or it's not being told to the public because they don't want it.
I agree with you 100%. Let's go to the phone calls. Wes in Idaho, go ahead. Real quick question for Dr. Orient.
Yes, Ted and Jane. I'm going to submit peanut allergies caused by putting peanut oil, which is totally unnaturally occurring, put it in as an adjuvant. It being put into the bloodstream, once again, it's totally foreign. So
now, Wes, hang on 1 second. Are you saying that peanut oil is being used as an adjuvant?
Yes.
I didn't know that. Did you know that, Dr. Orient?
I think it has been stated that some vaccines at some point have had peanut oil in them, but I can't give you the specific reference. It certainly does not apply to all vaccines.
Okay, Wes, thanks so much for calling. I apologize. I had to cut you off. Bill in Maine, go ahead. You got a quick question for Dr. Orient?
Hello?
Bill in Maine, go ahead. You got a quick question for Dr. Orient. Almost out of time.
Tetanus shot. I'm concerned most of us have, when we face physicals, they ask you when your last time you had tetanus shot.
Okay, Bill, thanks so much. Dr. Orient, what do you think about tetanus shots? Yay or nay?
Well, I never want to see another case of tetanus. I think tetanus is everywhere in the soil, and so I think it's a good idea to be immune to it.
Okay. Nathaniel in Kansas City, you got a question for Dr. Orient. Go ahead.
Concerning autism, the medical diagnosis manual now brings a lot of people into it that weren't in before. So I prefer concern rather than hysteria concerning how many more children are called autistic.
Okay, thank you, Nathaniel. What he's saying, Dr. Orient, is that, I'm sure you heard him, is that we have a broader definition of autism now, and he doesn't think we necessarily have that big of an increase. But what do you think about that?
Well, there's a big argument about that, but I don't know that the definition change explains an increase from 1 in 10,000 to like 1 in 50 or 60 or 70 children that we could not have mistaken that many cases of severe behavioral communications problems in the 1970s. The cases like that apparently did not exist except in very rare instances back then.
Again, I agree. One more phone call. Tim in Missouri. You're live with Dr. Orient. Go ahead.
Thank you. I basically got a comment for the listening audience, and I'll make this statement. I've contacted the Republican senator and the Republican...
We're almost out of it. Tim, we got to pick it up. We got about 15 seconds. Go ahead.
People, if you're don't want mandatory vaccines, for God's sake, call your congressmen and senators and tell them, because they're telling me that they think we should all have them. And Senator's aide yesterday told me that physicians and health practitioners that won't recommend it.
Sorry to cut you off, Dr.